by itself, it doesn't save anyone money, but it is stating what the goals are to be accomplished. It does put the players responsible for the higher healthcare costs on notice. Admittedly, I think President Trump has everybody's interest at heart. He really cares that there's affordable access to care, and there's ways to create legislation to do this through ERISA, through a Healthcare Consumer Protection Act, through medical cost transparency, where he wants the insurance company rates to be revealed, not the fake high retail ones, as you referred to them earlier, Rhonda.
Yeah.
And that's what we call a good start. He wants more tax advantaged things to happen. So, for example, there's a new HRA law that just passed it was in June, and it's allowing up to 800,000 more businesses to give money tax-free to their employees to receive the routine care they need to, because all the employees can afford is a high deductible. Now the employers can help them out tax advantaged. That was put into effect this year. In this executive order, things like the Christian share or any type of sharing plan that technically is not insurance now can be tax advantaged. There's a goal to make that into law also. And those would be some of the highlights that I can recall.
Oh, that's cool. That's really awesome, because some of those alternative plans, which I'm well aware of because of my license and some of the companies I represent, some of those alternative plans are really good, and they offer an option to people that, they fit. They don't fit everybody. I'm not saying that, so don't anybody misunderstand. But if you work with somebody that knows a lot of different plans, then you can pick and choose what's best for you and how you use healthcare. It just surprised me when people can't get what they truly need, and it's because they're misinformed or it's being blocked for some reason, and it's just so sad. It's unnecessarily bad. But
Very common for a carrier network to cost $30,000 to $40,000 for a family now per year. But if you really add up the healthcare dollars spent, it might be $3,000 are really used in a household per year.
yes,
So you're overpaying a good nearly $30,000 a year. Why don't we just pay for just the care we need? Just like we pay to paint our own front doors of our house. We don't ask State Farm for that, but it's there for a catastrophe if you have a fire or a flood.
right.
It should be the same in healthcare. Just pay for your routine care and have an insurance policy for catastrophe. The
Exactly.
laws aren't set up to do that, but that's where the market's heading with these alternative health plans. They're trying to finagle their way through a legal maze so that they can offer the catastrophic plans that are needed for America's working poor.
Well, there are a lot of people that would really like to have that catastrophic plan. And I do have one plan that covers, it's very affordable, by the way, that covers, your basic, all of your routine preventative maintenance stuff. So that all the stuff that might fall into your deductible that's really not that cheap, it just covers all of that. So there are a couple options available. It's just getting the news out there, and then of course it's another premium for people to pay. And I can understand their frustration. If they're paying premiums at work and then they're paying premiums on the side, pretty soon they have to choose between premiums and groceries. Well, I don't know about you, but I'm choosing groceries every time.
So am I.
Yeah, you know, and I'm not that big of a person, but I do manage to eat quite a bit. So anyway, oh, and I noticed something in what you sent me that um you're gonna add something called quality ratings. What are those?
Well, we are. Again, we're at Pratter, we're focused mostly on the routine care. So for an imaging study or blood work, they're same machinery, same state and federal regulations, no doctor involved. There's no need to pay $500 at one place or $2,000 another place in the same city. But for the surgery center care, the most common care that can occur in outpatient setting where the doctor must lay his or her hands on you for upper or lower GI scopes, carpal tunnel releases, knee arthroscopies, maybe even hip or knee replacements. We have at Pratter partnered with another company to offer quality ratings. Over 20 databases and 300 quality metrics are weighted to help identify the best quality for facilities such as hospitals and surgery centers, and then also the doctors that work in each of those. So we are an unbiased third party. We have not partnered with any hospital or insurance company. We're on your side. Our ladies that answer the phone, we call them our Pratter friendlies. Everybody knows what a friendly is. So they can tell you who the highest rated doctors and hospitals are where you live for a certain procedure, or you can look it up on your own on our website. Effective actually just this month of August. We've been working hard at it.
Oh, that is so cool, because you can do that. I know you can do that in our area for things like daycare centers and stuff. And of course, in the Medicare arena, there are star ratings for the third-party administrators or the plan sponsors, whatever you want to call them, that people can look at so they know when they're looking that they're getting somebody that has a good outcome on a steady statistical basis. And
yes,
it's just
there's things that need to be monitored that are, a lot of the star ratings are subjective. If a doctor is on time, he gets the 5-star. If he's not, he gets a 1-star. He's nice, it's a 5-star. He's not as personable as you, Rhonda, he gets a 1-star. So we like to get away from that at Pratter and say, okay, here's average length of stay, here's infection rates, and here's the volume with those of us, no matter what we do in life, if we do it more often, we're better at it than if we did it less often. And there's a lot of different objective parameters that go into the ratings. Is it perfect? Absolutely not. But is it more than most of the hospitals and surgery centers are willing to tell you on their own? The answer is yes.
Absolutely. Oh my gosh. Ask them their outcomes data and they all look at you and turn green and they think they're going to pass out behind their little desk. Well,
the most accountability in a capitalistic world where there is consumerism occurs when there's no middleman. And in healthcare, you have a middleman. You have the insurance companies. If I'm handing you $1 for a fee for service, whatever your service is at my place of business or my household, there's accountability when there's no. I need to know what I deserve for my dollar because I'm personally giving you my dollar.
Exactly. Now, in our last minute we have left, Dr. Bill, tell people how they can get to your website and your medical friendlies.
Our homepage is pratter.us, as in United States. I can go to pratter.us. If anybody wanted to get in contact with me to do a business as a business or my staff, we have a team tab in the bottom left-hand corner, and they can email us directly. On the homepage, near the top on the right is sign up for an account. There's an orange button, and any person can join, and you can call our Pratter Friendlies as often as you wish and do as many searches as you wish. You can switch your networks from one insurance company to the other. And we realize that you may want to have a relative on the other side of the country, and we're just going to let you use it to help millions, save billions on medical care.
That is So awesome. And it's been so great to have you back again because I just think this is a message that bears repeating. Plus, it was just, we just couldn't pass up the opportunity to hear it from someone who went to witness the signing of an executive order. But this is so important. And there's so much discussion going on about it right now that people need to learn to do a little bit of shopping before they go out and get a procedure. Just like you do a little shopping before you go out and get a new cell phone or anything else. And it is so
10
awesome.
seconds easy.
Yep,
That's all we want.
absolutely.
10 seconds easy. Find the better price places. Know that they're in your network. They're vetted. But we're making it easier for you to save money so that you can do more in the rest of your life. Better
well, thank you so much for being here. And listen, folks, thank you for listening in. And until next time, you know what I'm going to say. Be grateful, and you will attract good things. Thank you for being here. And I'm Rhonda Cobb, the Money Coach.